Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Let's just picture this for a moment. A pregnant woman, so excited about her baby, but at the same time, she's facing this silent, really devastating threat, malaria. Just a massive problem in global health. It can cause these tragic miscarriages, low birth weight, babies born too early. It's terrible for both mothers and their babies.
Absolutely devastating.
And for decades, there's been this one drug, sulfadoxine-pyrimethamine, that's been like a frontline defense, a real lifesaver for so many.
Right, a cornerstone of prevention.
But there's been this growing worry, this kind of looming question mark. Are the malaria parasites getting resistant? Is this vital treatment actually losing its power?
That's been the big concern, yeah.
Okay, so here's where it gets really fascinating. What we're digging into today, it pretty much flips the script on what we thought about this drug's value now.
It really does.
We're pulling insights from a huge new international study.
Yeah.
We've looked at a recent health news article and, importantly, the detailed scientific paper itself, published in The Lancet Infectious Diseases.
A top journal.
Exactly. So get ready for some genuinely surprising insights here.
Yeah, and what's really striking here is this isn't just one new study. It's a massive piece of work.
Yeah.
An updated systematic review and meta-analysis. Basically, that means researchers gathered up data from loads of previous studies.
Right, combining everything.
And analyzed it all together really rigorously to get the clearest possible picture.
And the scale sounds incredible.
Oh, it is. They looked at 122 studies. Think about that.
Wow.
Almost 150,000 pregnant women across sub-Saharan Africa. So this builds on earlier work, but it's, incredibly robust because of that scale.
So what was the main goal? What were they trying to figure out with all that data?
Well, the central aim was to really pin down how effective sulfadoxine-pyrimethamine still is for preventing malaria during pregnancy.
Especially with that resistance issue hanging over it.
Exactly. Especially in the face of increasing drug resistance in the parasites themselves.
And how did they actually do that? Matching up resistance and outcomes.
Yeah, it was quite sophisticated. They matched up information on, malaria infections at delivery and birth outcomes, things like birth weight, with data on specific genetic changes, molecular markers, in the malaria parasites that show resistance to sulfadoxine-pyrimethamine, things like specific mutations in genes dihydroterat synthase, for example.
Okay, so looking at the parasite genetics.
Right, and they were careful to adjust for other things, too, like HIV infection rates, or whether women were using insecticide-treated bed nets, to really isolate the drug's effect.
Okay, so a huge effort, careful methods. What did they actually find? You said surprising revelations. What was the first discovery about sort of the direct malaria prevention?
Well, the first part, it confirmed what we kind of suspected, unfortunately.
Right.
As the malaria parasites become more resistant, sulfadoxine-pyrimethamine does become less effective at actually preventing the malaria infection around the time the baby is born.
So it works less well against the infection itself.
Yeah. And in places with really high resistance, the drug showed basically no measurable effect on preventing those infections at delivery.
Okay, that fits the resistance worry. That makes sense. But you mentioned a dual effect. What was the unexpected twist? The bit about the babies.
Yeah, this is the truly groundbreaking part. What they found was, crucially, even where parasite resistance to the drug was very high, sulfadoxine-pyrimethamine still gave significant, really important protection to the babies.
How so? What kind of protection?
It consistently cut the risk of low birth weight by about 25% to 45%. That's substantial.
Wow. Even when it wasn't stopping the malaria infection as well.
Exactly. And what's really remarkable, the study found no evidence that higher resistance weakened these effects on the baby.
No evidence. So the protection for the baby held strong regardless of resistance levels.
That's what the data showed. And this consistent benefit wasn't just for low birth weight. They saw it for other key things, too, like preterm birth and also maternal anemia.
That's kind of amazing. Like finding out your old umbrella still keeps you dry, even if it's got a few holes and stopping the rain directly hitting you, maybe.
Huh? Yeah, maybe something like that. It's this unexpected continued benefit.
So why? Why does it keep helping the babies if it's struggling against the malaria parasite itself? What's the thinking there?
Yeah, that's the million-dollar question, isn't it? And it's really intriguing. The researchers suggest that maybe sulfadoxine-pyrimethamine also acts as a kind of broad-spectrum antibiotic.
An antibiotic.
Meaning its benefits for the baby's health, for birth outcomes, might actually be separate from its main job of fighting malaria.
So it's doing something else beneficial on the side.
Potentially, yes. There are a few ideas about how it could be influencing the mother's gut microbiome, the bacteria in her gut.
Right.
Or maybe it's dampening harmful inflammatory responses in the mother's body, sort of calming things down.
Less inflammation could definitely help a pregnancy.
Or perhaps it even helps the mother gain weight better during pregnancy. And there's actually some lab evidence starting to back this up.
No, yeah. Like what?
Well, there was one study done in vitro, so in the lab, using this pretty cool organ-on-a-chip model. It's like a tiny working replica of a human intestine.
Wow, okay.
And it suggested sulfadoxine-pyrimethamine had a strong positive effect on gut health. It seemed to reverse problems with nutrient absorption in the gut cells and reduce inflammatory signals, these things called cytokines.
Fascinating. So lab evidence points towards gut health and inflammation.
And there was also a trial in Uganda that reported fewer non-malarial fevers in pregnant women taking the drug. So less illness overall, maybe.
Interesting.
Yeah. Dr. Anna Maria van Eyck, who led this big meta-analysis, she summed it up nicely. She said, even in areas where this drug's ability to prevent malaria is compromised, it still protects babies from being born too small through beneficial effects that are not related to malaria.
Not related to malaria. That's the key phrase.
Exactly. She called it an incredibly important result for maternal and child health. And it really is.
Absolutely. So, okay, we've uncovered this sort of hidden power. What does this actually mean now for, mothers and babies on the ground, for the health programs making decisions?
Well, it provides really essential guidance for doctors, nurses, policymakers, everyone involved.
Oh, so?
The bottom line is the study confirms that sulfadoxine-pyrimethamine should absolutely keep being used in antenatal care.
So don't stop using it.
Definitely not. Because of these persistent important benefits for birth outcomes. And crucially, they found no evidence that continuing to use it caused any harm during pregnancy.
That's vital. No evidence of harm.
And it aligns with current recommendations, too. The World Health Organization still recommends sulfadoxine-pyrimethamine. It's the only drug they currently recommend for malaria prevention during pregnancy across Africa.
So this study reinforces that recommendation, but with a more, maybe, complex understanding.
Exactly. It gives us a much more nuanced picture of these dual effects. You've got the antimalarial effect, which is declining with resistance.
Right.
But you've also got these stable, crucial benefits for the baby's health at birth.
Yeah.
Professor Faiko Takile, who was a senior author on the study, he put it this way. These findings provide crucial guidance for malaria control programs. He said, while we must continue our search for more effective alternatives.
Which is still important.
Absolutely. This research shows that current prevention strategies continue to provide important benefits for maternal and child health.
That's incredibly reassuring, especially for areas relying heavily on this drug.
Huh.
But what about those limitations you touched on earlier? Observational studies having potential bias, maybe data not perfectly matching up everywhere. Do those weaken this core finding about protecting babies?
That's a really fair question. And yes, the researchers acknowledge those limitations. Observational studies can have biases you can't fully control for. And, matching local resistance data perfectly in time and space for every single study included is really challenging. Some specific comparisons might have had smaller numbers of participants.
Okay.
But, and this is the important part, despite those limitations, the researchers are confident that the core finding holds strong. The significant benefits for the mother and the fetus, particularly reducing low birth weight, are robust.
So the limitations are more about sort of refining the details rather than questioning the main message.
Precisely. They highlight areas where we need, even more research to get a finer-grained understanding, but they don't really undermine that central, powerful discovery about the non-malarial benefits.
Right. Which leads to the next obvious question. What is next then?
Well, it definitely raises that important point. While it's great news that sulfadoxine-pyrimethamine still provides these critical benefits, there's still a really pressing, urgent need for new tools. We need new drugs or vaccines or other innovative ways to protect pregnant women effectively from the malaria infection itself.
Because preventing the infection is still the ideal goal.
Absolutely. And to further improve outcomes for both mothers and babies, And alongside developing new tools, there's a strong call for more research to really dig into how sulfadoxine-pyrimethamine has these malaria-independent effects.
That understand that hidden mechanism better.
Exactly. How does it actually provide these unexpected vital benefits? Understanding that could be really important.
This whole deep dive really paints such a fascinating picture, doesn't it? You have this long-standing drug, sulfadoxine-pyrimethamine.
Hmm.
Everyone was worried it was, on its way out because of resistance.
Hmm.
And then, boom, it reveals this kind of hidden superpower. It's still protecting the most vulnerable mothers and their babies in ways we just didn't fully appreciate before.
It's a remarkable story of scientific discovery, really.
So as you listen to this, maybe think about what this deep dive into sulfadoxine-pyrimethamines dual effects tells us. What does it say about just how complex drugs can be and how much ongoing innovation we need in global health?
Yeah, it's a great point.
Consider how solutions that seem straightforward can actually have these really profound, multi-layered benefits. And it highlights the kind of continuous scientific detective work that's needed to uncover them, doesn't it?
It absolutely does.
It's just a powerful reminder, I think, of that relentless search for knowledge that ultimately helps keep us all safer and healthier.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.